Hello, my name is Lakshmi, and my project is on disparity in lead poisoning among African American children under 6 years of age in Michigan, USA. First, on the background on lead poisoning. Lead poisoning occurs when lead builds up in the body, often over months or years. And on January 2012, CDC has set elevated lead levels above 5 microgram per deciliter as a level of concern. The overall prevalence of lead poisoning has decreased, and at present, the greatest risk factor is living in pre 1978 homes containing lead based paint in deteriorating and abandoned conditions. African Americans still experience a disproportionate burden of lead poisoning, and this can be reflected in on comparing four counties: Wayne, Wexford, Clare, and Livingston counties in Michigan. These counties have different racial and socioeconomic profile, and Wayne County, with the highest African American population, has the highest prevalence of lead poisoning, and within Wayne County, Detroit City, with predominant African American population, is affected most. Higher poverty rates, unemployment, food deserts, and limited access to healthcare are all contributory factors. However, social determinants cannot explain the disparity alone. Clare County, with predominant white population, have comparable socioeconomic factors to Wayne County, but the prevalence of lead poisoning is 0%. This shows how residential and racial segregation plays an important part. And this slide shows the current conditions. And the first chart demonstrates how Wayne County is still disproportionately affected. The second chart shows that the Wayne County has highest African American population among the four counties, and Detroit City has predominant black population. And the third chart shows how Wayne and Clare County have higher poverty rates than the other two counties. This chart shows how Wayne County has the highest risk factor for lead poisoning because of the larger number of pre 1950 built housing units. And now the problem statement. Even minimal amount of lead exposure is dangerous to health. The effects of lead on brain and nervous system is permanent, and since in young children under 6 years of age, the brain and nervous system are still developing, they are more vulnerable. And moreover, young children have a tendency to chew on peeling paint from the walls and windowsills, which put them at increased risk than adults. Lead poisoning results in decreased IQ, neurological, and behavioral problems which are irreversible, so it's important to mitigate the sources of lead exposure. 2-year-olds with elevated blood levels in 2014 were expected to experience a loss in lifetime earnings totaling $171 million, and 10% of juvenile crimes in Michigan are associated with lead exposure. This chart shows how institutional racism leads to residential segregation and various social determinants and risk factors and behaviors for increased prevalence of lead poisoning and overall increased mortality among African American children in Michigan. And the targets and goals are to ensure the elimination of the existing disparity in prevalence of lead poisoning, and some of the goals include ensuring adequate data collection, access to quality healthcare, health education and awareness, and 100% screening rates, identify and address socioeconomic factors contributing to existing inequality, and social justice strategy implementation, improved housing conditions, mitigate water, soil, and air resources of lead exposure, stringent follow-up and monitoring services, focus on community engagement and feedback, partnering with different organizations, and adequate tracking of response and ensuring adequate funding. And the countermeasures focus on social justice principle to counteract the effects of race and racism and segregation. The Michigan Civil Rights Commission was set up in response to the Flint water crisis in Michigan to counteract the effects of racism through replacing Michigan's emergency manager law, developing a plan of action to provide environmental justice, and developing a deeper understanding of the role of structural racialization and implicit bias. And social justice strategies is implemented by the Child Lead Poisoning Elimination Board, and a few of their goals include 100% screening of children for elevated blood levels in Michigan, and follow-up monitoring services for those who have identified lead levels above 5 microgram per deciliter, and preventing further environmental lead exposure through home, soil, water, and product exposure mitigation strategies. And another important strategy is low-income housing tax credit development in Detroit. Uh, and this program is enacted as a part of Tax Reform Act of 1986, and it provides federal tax credit for low income rental housing owners and investors instead of providing direct development subsidies. and the program has helped in renovating about 6,000 older housing units and building of 5,000 newer housing units. And this helps in mitigating the greatest risk factor for lead exposure, that is living in pre-1978 houses in abandoned and deteriorating conditions. Thank you for listening, and I look forward to hearing all of your presentation. Bye.